Good morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan, Vihar University. Today I will discuss about the topic is patient counseling. How to counsel the patient. First of all, discuss about the discuss about the learning objectives of this topic. Upon completion of this topic, the student should be able to like what is patient counseling, and next one goals of patient counseling, and next one objective is objectives of patient counseling, and what is counseling process, and functions of patient counseling, and qualities of good counselor, and techniques of counseling process, and next one objective is stages of counseling process, and last one objective is benefits of patient counseling. These are the learning objectives of this topic. Next one, learning outcomes of this topic. First of all, on successful completion of unit, students will be able to like what is patient counseling. Next one, outcome is goals of patient counseling, and next one, learning outcome is objectives of patient counseling, and next one, what is counseling process, and functions of patient counseling, and qualities of good counselor, and techniques of counseling process, and next one learning outcome is stages of counseling process, and last one learning outcome is benefits of patient counseling. That are the learning outcomes of this topic. Next one, first of all, discuss the patient counseling. Bartlett is plant learning and plant learning experience using a combination of methods. Experience using combination of methods such as teaching, counseling, and behavior modifications techniques that influence patient knowledge and health behavior. The plan of learning experience using combination methods like teaching, counseling, and behavior modification techniques. Next one, what is patient counseling? What is patient counseling? Patient counseling is one of the major duty of a pharmacist and other than dispensing of drugs. The major duty of patient counseling of the pharmacist and other than dispensing of drugs. Next one, it is refers to the process of providing information and advice and assistance to help patients to use their medication appropriately. The main objective of patient counseling is provide information to patient by the pharmacist and advice and assist to help to the patient how to use medication properly. Next one, patient counseling may be defined as providing. Patient counseling may be defined as providing medication information and orally or written form to the patient or their representative or providing proper direction of use and advice on side effects, storage, diet, and lifestyle modification. The main aim of the patient counseling is to provide medication information by orally and written to the patient and their representative or providing proper directions of uses, advice and side effects, storage conditions of drugs and diet and lifestyle modifications. Next one, provide patient education. Provide patient education. How to provide patient education? First of all, in an attempt to provide patient education, there are many different things to consider. In an attempt to provide patient education, there are many different things to consider, like health professional information and health literacy. Health professional informations and health literacy and critical thinking. And next one, knowledge generation and knowledge dissemination activities and health consumer informations and healthy literacy and readability, that are the provide patient education via the pharmacist. Next one, goals of patient counseling. What are the goals of patient counseling? What are the goals of patient counseling? First of all, to provide information. First of all, to provide information directed at encouraging safe and appropriate use of medication and thereby enhancing therapeutic outcomes. The main goal of patient counseling to provide information to the patient and appropriate use of medication and enhancing therapeutic outcomes of medicines. That are the goals of patient counseling. Next one, objectives of patient counseling. What are the objectives of patient counseling during the patient counseling? First of all, patient should recognize the importance of medication for his well-being. The main objective of patient counseling to recognize the importance of medicine for his well-being to patient. And next one objective, a a working relationship and a foundation for continuous interaction and consultation should be established. The next one objective is a working relationship and foundation for continuous interactions and consultation should be established between patient and healthcare professional. Next one objective is patients undertaking a working relationship and a foundation for continuous interaction and consultation should be established. And next one objective of patient counseling is to patients undertaking of strategies to deal with medication should be improved. How to improve medication? The and next one should ensure better patient compliance. That are the objectives of patient counseling. Next one, patient become a informed, efficient, and active participants in disease treatment and self-care management. And next one objective, the pharmacist should be perceived as a professional who offers who offers pharmaceutical care. And next one objective is drug interaction and adverse drugs reaction should be prevented by the professional patient counseling. Next one, counseling process. Counseling process of first of all, counseling process use following. First of all, verbal communication, and second one is non-verbal communication. First one, verbal communication, in which verbal communication, how to counseling. First of all, language, tone, volume, and speeds. That are the verbal communications. And next one, non-verbal communications like proximity, eye contacts, and facial expressions. That are the counseling process. Next one, communication. First of all, communication is the transfer of information and meaningful to those involved. And next one, it is the process in which messages are generated and sent by one person and received and translated by another person. Communication is the process and in which messages are generated and sent by one person and received and translated by another person. That are the communication skills. Next one, functions of patient counseling. Functions of patient counseling. Next one, effective patient counseling. Next one, effective patient counseling aim to produce the following results. First of all, better patient understanding, better patient's understanding of their illness and the role of medication in its treatment. And next one function of patient counseling is to improve medication adherence. And next one function is more effective drug treatment. And last one function of patient counseling is reduced incidence of adverse effects and unnecessary healthcare costs. That are the functions of patient counseling. Next one function is improved quality of life for the patient. Improved quality of life for the patient. And better coping strategies to deal with medication and related adverse effects. And next one is improved professional reporting between the patient and pharmacist. Next one, qualities of a good counselor. What are the qualities of a good counselor? Like be a good listener, be a good listener, be flexible, and be empathetic, and be non-judgmental, and be tolerant. And last one quality of a good counselor is communicate confidently. That are the qualities of a good counselor. Next one, communication during drug therapy. Communication during drug therapy. First of all, purpose of medication. What is the purpose of medication during the drug therapy? And how medication work in human body, And next one, dose and duration of therapy, and goals of therapy, and how effectiveness will be monitored during the drug therapy. How to monitor effectiveness of drug therapy. And next one, adverse effects and how to deal with them. How adverse effects and how to deal with them. And next one, drug specific issues that are the communication skills during drug therapy. Next one, techniques of counseling. How many types techniques used in the patient counseling? First one, stage first, and next one, stage second. First of all, discuss stage first. Medication information. Medication information transfer during which there is no monologues by the pharmacist providing basic brief information about the safe and proper use of medicines. First of all, medication information transfer during which there is monologue by the pharmacist providing basic brief information about the safe and proper use of medicine. And next one, stage second, in which stage second medication information exchange during which the pharmacist answer questions and provide details information attached to the patient situation. In which stage second pharmacist give answers to the patient and detailed information provide for the medication therapy according to patient situation. Next one, stage third. Stage third, medication education during which the pharmacist, medication education during which the pharmacist provides comprehensive information regarding the proper use of medicine and collaborative interactive learning experience. And next one, stage 4, medication counseling during which the pharmacist and patient have a detailed discussion intending to give the patient guidance that enhance problem solving skills and assist with proper management of medical condition and effective use of medication. That are the techniques of patient counseling. Next one, stages in the counseling process. Stages in the counseling process. First of all, recognize the need for counseling. Recognize the first one stage first one stage during the counseling process is recognize the need for counseling, and second one counseling process is assessing and prioritizing the needs, and third one counseling process is specifying the assessment methods to be used, and next one counseling process is implementing, and last one stage in the counseling process is assessing the success of the process. That are the stages in the counseling process. Next one, when it is necessary. When it is necessary, first of all, during a when it is necessary, first of all, during an ambulatory clinical visit. First of all, when it is necessary during a ambulatory clinic visit, and next one on admission, beginning with the medication history interview, and next one counseling throughout and inpatient stay. Last one is immediately prior to discharge or at discharge. Next one, primary steps of patient counseling. First of all, identifying the patients during the patient counseling, and then introducing yourself. Introducing yourself means pharmacist introduce yourself, and next one, adopting suitable physical position to enable counseling to take place comfortably and effectively. Adopting suitable physical position to enable counseling to take place comfortably and effectively. Next one, if multiple medications, if multiple medication organizing the drug in a local logical sequence, the multiple medications organizing the drug in logical sequence. And next one, utilizing other counseling aids when appropriate. That are the primary steps during patient counseling. Next one, procedure of patient counseling to patient by the pharmacist. First of all, patients with serious or unstable disease states. Patients with serious or unable disease states. And next one, patients receiving patient with serious or unstable disease state, and patients receiving specific medications for the treatment, and patients treated with complex drug regimen during the drug therapy, and patients whose established medication have been altered. And next one, elderly or pediatric patients, and patients with language or reading difficulties. And last one, procedure, patients identified as non-intentional non-compilers. Next one, steps during patient counseling. What are the steps involved during patient counseling? First of all, preparing for the session for patient counseling, and opening the session for patient counseling, and counseling content prepare for patient counseling in like name and description of the medication, name and description of the medication, and reason why it has been prescribed or how it works. Next one, reason why it is has been prescribed or how it works, and how to take the medication to patient, and expected duration of treatment, and expected benefits of treatment. And next one, possible adverse effects during the patient counseling, and possible medications of dietary interactions during the drug therapy. That are the steps involved during patient counseling. Next one, steps during patient counseling. First of all, advice on correct storage. First of all, advice on correct storage. The pharmacist give advice to the medication storage conditions. And next one, minimum time duration required to show therapeutic benefits. Minimum time duration required to show therapeutic benefits. And next one, what to do if a dose is missed. What to do if a dose is missed by the patient. And next one, Special monitoring requirements. Special monitoring requirements during the drug therapy. Next one, closing the session of patient counseling. Closing the session for patient counseling. Next one, barriers of patient counseling. Barriers of patient counseling. What are the barriers of patient counseling? First one barrier is lack of time. First one barrier is lack of time, and next one barrier is lack of knowledge about drug and patient's history. Next one barrier is lack of knowledge about drug and patient history. And next one barrier of patient counseling is lack of confidence. And next one barrier of patient counseling is poor communication skills and language barriers and lack of awareness by the patient of the need for counseling and its availability. The awareness is the most important barrier for the of the patient counseling. And next one, physical barriers are involved in the patient counseling. And next one barrier is economic consideration and poor patient perceptions of the pharmacist. And next one is administrative barriers. Next one, negative attitude of healthcare practitioner during the patient counseling is the barrier, and poor patient perceptions of the pharmacist. That are the barriers of patient counseling during the drug therapy. Barriers to communication in counseling. Next one, steps to becoming steps to becoming a counseling pharmacist. Steps to becoming a counseling pharmacist. First one step is evaluate your own values and priorities. And next one step is evaluate barriers to patient counseling. And next one step is arrange for removal or reduction of barriers where possible. And next one step is arrange for counseling aids. And next one step is prepare staff, physician, and patients for the patient counseling, and prepare for each counseling session for the patient counseling and progress into counseling in the steps. And next one is remember to tailor counseling. And next one, arrange for practice. And last one step is self-evaluations. That are the steps to becoming a counseling pharmacist. Next one, false assumptions about patient understanding and medication adherence. False assumptions about patient understanding and medication adherence. First of all, do not assume that previous physician. Do not assume that previous physician have already discussed with patients to medication they are prescribed. And next one, do not assume patient understand all information given. And next one, false assumption is do not assume that if patient understand and what is required, they are able to take medication correctly. And next one, false assumption is do not assume that patients don't take medication because they do not care or not motivated. And last one false assumption is do not assume that once patients have a problem, they will contact you. That are the false assumptions about patient undertaking and medication adherence. Next one is medication counseling tips. Sorry, medication counseling tips. First of all, establish relationship between patient and pharmacist and shows interest in patient verbal and non-verbal. The verbal or non-verbal interests show in patient and establish relationship. And next one, verify patient name and prescriber name. Verify patient name and prescriber name. And next one, why the patient why the patient is being prescribed the medication, if none or the medication use expected benefits and actions. And next one, open the medication container. Open the medication container and show patients what the medication look like or demonstrated use. That are the responsibilities of pharmacist to the patient. And next one, medication counseling tips. How to take the medication. Patient, how to take the medication and when to take a, how long to take the medication. And next one, medication counseling tip is what to do if a dose is missed and any special precautions to follow during the medication counseling tips. That are the medication counseling tips. Next one, foods, alcoholic behaviors or over the counters to be avoided during the drug therapy. And next one, how the patients will know the medication is working and how to store the medication. Pharmacist is providing storage guidance to the patient for the medication. And next one, if the prescription can be refilled, and if so, when verify the patient's knowledge and undertaking understanding. Verify the patient knowledge and understanding. Next one, ask the patient if they have any questions. And last one, document the interaction. Next one, patient who should always be counseled. First of all, confused patients and their caregivers. Confused patients and their caregivers. And next one, patients who are sight or hearing impaired. Next one, patients with poor literacy and patients who profile shows a chance in medication or dosing. They are the patients who should always be counseled. New patients or those receiving medication for the first time. And next one, children and patient receiving medications. Next one, patients receiving medication with special storage requirement and complicated directions and significant side effects. That are the counseled for the patient counseling. Next one, key points in counseling. What are the key points during the patient counseling? First one key point is name of the medication. First one key point is name of the medication, and next one key point is how to take the medication. Next one key point is how to take the medication, and next one key point in counseling is warning about medication. Warning about medication is the key point of counseling, and next one key point is storage of medication. How to store medication. Next one is sundry items. And last one key point in counseling is purpose and outcome of treatments. That are the key points in counseling during the patient counseling. Next one, benefits of patient counseling. What are the benefits of patient counseling? First of all, satisfaction of having fulfilled his her professional duty. The first of all benefit of patient counseling to patient is satisfaction of having fulfilled his her professional duty. And next one, surviving patients and their well-being. And next one, improve patient compliance via the healthcare professional like pharmacist. And next one, pharmacy is seen a professional or caring pharmacy. Pharmacy is seen as professional or caring pharmacy. Next one, formation of trusting relationship with patients. Formation of trusting relationship with patient by the pharmacist. Pharmacist is form, form the trusting relationship with patients. That are the benefits of patient counseling. Next one, counseling aids for patient counseling like medication cards are helpful in counseling aids. And next one, patient information leaflets are used to the counseling aids for the patient counseling. That are the counseling aids like medication cards and patient information leaflets. Next one, that are the references for this topic. First one reference is Hospital Pharmacy by William E. Hassan, GR 5th edition, page number 124 to 153. And next one reference is a textbook of pharmacy practice by K.Z. Ravi Kumar and P.D. Meglani, first edition, page number 82. And third one reference is Remington, The Science and Practice of Pharmacy, 21st edition, volume 2, and page number 2259. And last one reference for this topic is Merchant and Quadri as a textbook of hospital pharmacy, page number 39 to 50. That are the references for this topic. Next one, multiple choice questions for this topic. First one question. Which of the following would not be an explain of an effective need assessment questions? Option A, how is your treatment currently impacting your financial situation? Option B is, do you know what time your appointment is? Option C is, tell me about your household. Option D is, how many people are financially depend on you. The right answer is B. Do you know what time your appointment is? The right answer. Next one question. When providing patient counseling, what is the primary objective and to ensure that the patient gets good care? Option B is to meet the patient's needs and option C is to serve as an intermediary between the patient and their family. And option D is to get non-covered services reimbursed. Option The right answer is B, to meet the patient needs. Next one question. All of the following statements are correct when providing empathy to patients and families accept. Option A, develop a plan with your patient and families. Option B, meet your patients where they are. And option C is physical touch help you build instant reports. And option D is actively follow up with patients and families. The right answer is C. Physically touch help your build instant report. Next one question. All of the following are effective interventions for non-compliance except option A is reassure the patients that the situation will get, and option B is follow up with the patient and family, and option C is address non-compliance issue earlier, and option D is make an effort to recognize the family's coping strength and resource. The right answer is A. Reassure the patient that the situation will get better. Thank you. Thank you all of you for a wonderful session.